Welcome, everybody, to our final Dream Job webinar of the 2024 calendar year. I'm Danny Rubin, founder of Rubin. We provide online resources for employability skills to school divisions across the country. And one way we discuss employability skills and strong communication is through our Dream Job webinars. And we're grateful to have Dr. Richard Spector with us today from South Carolina, talking to us about physical therapy and about the work that he does with his patients every day. And we will jump in with him in just a minute. Thank you to those who continue to tell us hello in the chat. We have Laura here providing sign language support. And a couple of news and notes before we dive into our session today. One is, can you show me your Zoom hands? How many of you are here for the very first time? Is anybody here like new to our webinars? This is new to you. Okay. A few people, and a lot of returning folks too, and we love that. A couple of things. One, people often ask, are these sessions recorded? Yes, they're recorded. And we put all the recordings on our YouTube channel. And I would encourage you right now to go to the link I put in the chat to our YouTube channel and subscribe, because then you'll be notified whenever we put a new webinar on our channel. If you can't make it live, thank you, Lisa. So please go to our YouTube channel and subscribe, because we do put our recordings there. Separately, if you've been around the Rubin community the last couple of years, we do a special contest. And that's coming around right after New Year's. It's called America's Next Great Intern. And we have students compete on employability skills across the country. And we send all the top students to a public vote. And then we award a prize to the winner. The prize is a little TBD. We'll announce that in January. But please make a note of our contest and look out for emails about the contest in January. The contest runs the month of February. It is free, and students have a chance to showcase their skills and then receive a portfolio of how they wrote an email, a cover letter, phone skills. We've done different skills in the past. So we'll explain everything after New Year's, but just heads up that our contest is coming. America's Next Great Intern. This will be year number 3. Okay. With that, let's turn our attention to our special guest, Dr. Richard Spector. Thank you again for being here. It gets kind of a hectic time of year, a lot of running around, but you made time for us and we appreciate that. So Dr. Spector, start off by telling us your path so far and how you ended up where you work today.
Hey everyone, happy to be here. Really excited to talk to you guys and answer any questions that you might have. Doesn't feel like too long ago. I was just in high school, just someone interested in PT, and to be sitting here now and talking to you guys it's pretty fulfilling feeling. I grew up a little bit outside of Atlanta, Georgia, and then I went to do my undergraduate, my normal 4 years of college at Georgia Southern in a small town called Statesboro, Georgia, which is kind of the country, where I studied recreation. And after that, I went on to do my graduate school again at Georgia Southern, which is an additional 3 years of PT school to get your doctorate. And then after you make it through those 3 years of school, you have to pass the national boards exam in order to be able to practice. And so now I live in South Carolina and practice here.
All right. And so let's get into your work. And I want to share your company's website as we talk. And you can kind of share some of the services that you provide to your patients. As we start talking, I want to now encourage the teachers and students to go to the Q&A along the bottom of Zoom. And I'd like for you to start putting your questions. And when you write your question, please include your name and your school so we can give you credit. So start putting your questions to Dr. Spector. What do you want to know? And as we do that, I will share my screen and we'll look at the Wellness Institute in Bluffton, South Carolina, where you are located, and just kind of looking at your services. And as we look at the company website, what kinds of services do you provide patients? I'm looking at hip issues, pelvic issues. What kinds of things do you do?
Yeah, so the field that I work in is called outpatient orthopedics, which means someone comes to our physical location after an injury or after a surgery, or if they have some kind of physical impairment, whether that's balance or dizziness, as something they feel like is affecting their everyday life and their quality of life, and they want less pain or they want to be stronger so they can get back to doing the things that they want to do. So if you have an issue with your body from head to toe, I'm here to help you with that.
Give me an example of someone who came to you recently post-surgery and the kind of work you did with them.
Sure. So, just an hour ago, I saw someone who had a shoulder replacement. So when someone needs a joint replacement, it's because they have a lot of arthritis in their joint, which means that their arm or their hip is not moving as well as it once did because the surfaces that move together, they're not smooth anymore. All of their cartilage is gone. So when you get a joint replacement, it replaces those joint surfaces with metal or ceramic. And after a surgery like that, people need a lot of help regaining a range of motion, building their strength back up so that they can get back to doing their normal daily activities.
What are the most common surgeries that people have who then come to see you?
I would say probably joint replacement. So hip replacement, knee replacement, shoulder replacements are the big joint replacement surgeries. If it's not a joint replacement, usually there'll be like a rotator cuff repair. So what that means is someone's muscle will tear either in the middle of the muscle itself or where that muscle attaches to a bone. And then they have to take that muscle and reattach it to the bone so that it can continue to function as it once did. And that takes a long time because in the very beginning, you're just worried about that surgery holding and healing well so that it doesn't re-tear. And then and after the healing is done, then you have to work on getting it to work well again. So to be able to move the arm, be able to sustain weight, or if they're an athlete, being able to do their different kinds of specific sports without injury again.
Hmm. So thank you for that. And I'll get to everybody's questions in a moment. I want to demonstrate, explain to students what I'm doing because I talk about this in all of our webinars. I'm asking Dr. Spector follow-up questions. So we started talking about he sees somebody post-surgery. I asked him, what's an example of someone who came to you post-surgery? What are the most common surgeries people have to then come to see you? So I am peeling back the layers of the work he does, asking questions related to the previous question. And I have to imagine, Dr. Spector, when you're with your patients and you're asking them questions, sometimes you have a list of questions you have to ask, but are you oftentimes listening to what they tell you and asking follow-up questions, trying to dig a little deeper? Does that happen
Oh,
with you?
100%. 100%. In our field, we have to do what's called active listening, which
Hmm.
means that when someone is telling you something, you're asking them because the answer will help direct your treatment process. So if
Hmm.
you ask them something, it's very important to hear what they say and to be able to take that information and apply it clinically to know, okay, maybe this is where I need to head in this direction today as opposed to somewhere else.
Thank you very much. We're going to continue to talk about the communication skills required to be successful in the job as we go. We have some good questions already in the chat. We have Ian Holtzclaw. Does a physical therapist work at a hospital or at a separate clinic or somewhere else?
They can work in a hospital, they can work in a separate facility like I do. So physical therapy is a huge umbrella where the if you really just boil it down to two different scenes, you would have inpatient and outpatient. I
Okay.
work in outpatient. So that's like when you're driving down the street and you see somewhere that says Benchmark Physical Therapy. It's just a standalone clinic that you would travel to from your house. If we look at inpatient, that's in a hospital or in a skilled nursing facility where the patients are there for a prolonged period of time. So maybe someone is recovering from a stroke or a spinal cord injury. You would see that person in the hospital, and your goal when you're in the hospital is to get them to be able to tolerate leaving the hospital, being able to go back to their house. Can they use the restroom on their own? Can they walk down the hall? Can they use stairs? These are all little things that a patient in the hospital is going to have to do in order to leave, and that's the physical therapist's job in that kind of setting.
Okay. Thank you. Thank you for the difference. And let me ask the students. He said there really breaks down to two different categories, inpatient and what was the second one? Can you all tell me in the chat? Inpatient and what? I think that's really helpful distinction. A lot of good questions here. Let me go grab a couple more. And this, thank you very much, everybody. Outpatient is the answer. A question here came from two different people, and Elaf and Kristen Luongo. They both asked similar questions. What can students do in high school to prepare for a career in PT, physical therapy? What would you recommend, and what were you doing in high school, perhaps, or how would you direct them?
Well, I'll start with kind of how I got involved. I was an
Yes.
athlete in high school, and I had my fair share of injury. So my first exposure to PT was from being a patient myself. So if you're unfortunate enough to have an injury and go through physical therapy, I think that's how probably 90% of us get introduced to the field is being injured at some point and having to go through it. Looking back now, if I would say what's a very important thing to do for someone who's interested in PT is to go do what's called shadow. You can
Mm.
almost go to any physical therapist and ask them to shadow, which just means just tag along with them and see what their day-to-day is like. And this is usually an unpaid position, but several clinics will have what's called a tech position, which is an assistant who helps with cleaning tables and running patients through lower level exercises. And that's what I did in between college and grad school, because in order to get into PT school, you need to have a certain amount of observation hours or shadowing hours. So if you start now, it's a great way to just see what it's actually like and if it's something that you'd be interested in.
Oh, I love that. Okay, so let's break that down because if a student wants to shadow, and by the way, can they shadow in high school?
Yes, of course. You can do
Okay,
tech in high school as well.
okay. So how should students, like, let's say in your case, how should they reach out to you? Should they walk in with a resume? Should they call? Should they send an email? Let's talk about the actual process of seeking out the shadow opportunity. What should they do?
I think any of those options are great. Email is a perfect way to get to me. And all I would do is, make sure you have a subject line that has something about being curious about shadowing. And then email me a little bit about your interest in the field, why you want to shadow, and set up a time to maybe talk on the phone would probably be the most convenient option. Um, you could feel free to drop by a clinic. Most clinics have a front office coordinator, a front desk, staff where you could drop off a resume and say that you're interested in doing some shadowing, and they would relay that information to the therapist. Typically throughout the day, the therapist would be pretty busy with patients, so I wouldn't expect to walk in and talk to a therapist on the day, but either an email or dropping off a resume to front desk staff would probably be the best way to go about that.
Okay, so let me ask a couple questions about that. If the student comes in and walks in, should they be dressed like in sandals and a t-shirt? How should they look? How should they present themselves?
I would say you would what we'd call business casual.
Mm,
So maybe a collared shirt and khakis and a clean shoe. Tennis shoes are okay. Clean tennis shoes though. I would say,
okay.
look nice. Even though we're a workout facility where we do exercise, I wouldn't come dressed in gym clothes. I would try to look a little professional.
Okay. And what about that email? What if a lot of times students mistakenly write the whole email in the subject line, not knowing there's a message area or everything is lowercase like a text? Would you like that email to look professional? What would you like to see if they wrote you for the first time?
Yeah, I would say, it would be nice to have correct grammar and look professional because we all have, I guess, our biases, and just to see how someone communicates in a written fashion would give you a little insight to maybe how that person would act, in when they're actually in a clinic with another person. Because in this field, you're always working with people. You're going to work with me, the therapist. You're going to relay information from me to the patient. You're going to have to take information from the patient and bring it back to me and know what's important and the right way to let me know.
Yep. Yep. And I'm going to talk about writing a little more in a bit too. Thank you for these answers. Christina Toto
Hmm.
asks, can you tell us about your schedule? What are your hours like?
Sure. So Monday through Thursday, I work from 8 a.m. to 5:30. Typically, I like to get into the clinic a little bit early to prepare for my day. In a full day, I have 11 slots, so 45-minute slots. So 8 to 8:45, 8:45 to 9:30, so on with a lunch in the middle. And typically, I see 1 to 2 people in an hour slot, and never more than that. So it stays pretty fast paced. I'm definitely busy all day, but I love it. Yeah.
So there are times when you're like, you have two people for separate reasons and you're kind of like bouncing between the two. Are they like doing an exercise? You like kind of leave them to do it. You go back to this person and then back to the other person. Like, how does it work if you have multiple people at the same time?
Well, yeah, you should definitely need to plan it out. And I would say one of the most important things about being a physical therapist, especially in this setting, is having good time management skills and being
Ooh,
able to plan ahead.
let's talk about that. Take me into your time management.
Well, you know that I know I've got 45 minutes to an hour with a patient, and I know that at the end of that hour, I'm going to have 1 to 2 other people coming in and wanting to be seen at the time that they're supposed to be seen, not 10 or 15 minutes later than that. So you have to be able to structure a session and be able to get all of the important things done. So for me, I'm heavy what they call a manual therapist. So I do a lot of hands-on stretching or joint mobilization or soft tissue work, dry needling, cupping, you name it. And then we'll follow that usually with exercises so that the patient can strengthen in the range of motion that we try to gain through manual therapy. So you've got to be able to plan that with one person and be able to give the other person just as much of a high quality care if you're seeing them both at the same time. So that takes, you've got to know the person that you're seeing, you've got to know the condition that you're going to treat and know what's going to be the most important thing to do first with patient A while patient B is staying busy doing something else. And then being able to switch back and forth so everyone feels that they are getting a high quality care and that they're getting better. Because there's nothing worse than someone that feels like they're on the back burner, that they're not getting the care they deserve because you're focusing on somebody else.
So, like, are those when you have sort of two people at once, is it often people you've already seen them once for that initial consultation? Because maybe that first time you need to kind of like give them your attention to like assess them. And maybe when it's like their fifth or sixth time through, then you can sort of,
Yeah,
kind of
it
set them
always gets
off
easier the
independently.
more that you see somebody. When we do an initial consultation or an evaluation, that's always one-on-one because you've got to talk to that patient and hear their story, learn who they are, do a review of their medical history, and then give a full examination to try to determine what the problem is for that patient coming in. And then often when it's their second visit or they're coming back into for a true treatment session, we usually keep that just one-on-one. And then from there, depending on the condition, now I have some patients who are after a stroke or they're a very complex patient that require all of my attention for the full 45 minutes. Those are people that I might specify to my front desk, hey, don't ever double this person because they're going to need me for the full 45. But if you have someone who's like a knee replacement, typically, it's not too tough. They can come in, they can ride the bike and warm up. I'll go over and give them their stretches and stretch on them. And then usually it's pretty simple for them to go through some exercises. And that's where a tech might come in and say, okay, I'm going to help you go through exercise ABC while Dr. Spector is running off to do the manual for somebody else. And
Let's
then he'll
see.
come back. Yeah,
Let's see. We have some other good questions and I want to get to them in a moment. I have a cousin who's a chiropractor, and he often talks
sure.
about some of the more challenging patients, not just their challenging medical situation, challenging people,
For sure.
difficult personalities. You're cycling through upwards of 11 or more people a day coming through, and they're all completely different in how they react to instruction, if they're really frustrated about their medical condition, or they have a more optimistic tone to them. How do you learn to sort of manage the different personalities that fly through your office every day?
Yeah, you're so spot on with that. And then, you've got so many different personalities of people that you're seeing all day long, and there's no escape. You're always with somebody. And then if you take a difficult personality and you put that person in a 9 out of 10 pain, they don't get any easier to deal with. I can tell you that. Um, but the one thing that I actually learned this as an undergraduate, is the phrase unconditional positive regard. What that means is that no matter what, unconditional, no matter what, you keep a positive regard, which means a positive outlook. No matter what is going on with the patient, you're always their biggest supporter and that you're going to get through it. And I haven't met anyone that gets upset when you're positive to them like that.
That's amazing. By the way, I put it in the chat and I named it UPR. That should be like a
Perfect.
specific
Trademark
medical
it.
term.
Yeah,
That should go in the medical textbooks.
I agree.
Unconditional. Raise your hand if you like that answer. I love that answer. If you just give positivity, that's all you can do. and at least the positivity won't make them angrier, right? So
Right.
maybe you don't, maybe they're not super happy all the way through, but at least you're not going to agitate them. And I love that answer. And you talked about learning through your textbooks, and I want to ask a question that came from Mr. Thompson and his students in Minnesota. Um, Take us through like the schooling again. You talked about it in the
Mhm.
intro. How much schooling is required? Education, undergrad, advanced degree? Like go through that process again. Break it down for us.
Sure. So, as an undergraduate, if you're familiar with what that term means, that's your first 4 years of college, right? Your
Thank
freshman through
you.
senior year, that's what they
Thank
call
you.
being an undergraduate. So you can get a degree in absolutely anything as long as you do the prerequisite classes for physical therapy. So I had people who were music majors, IT majors, but there's probably 6 to 8 classes that you must take in order to apply to PT school. Those are usually going to be 2 anatomy classes, 2 chemistry classes, 2 physics, and 2 biology courses. Now, you could go into a major that would set you up a little bit better, where you would already take those classes, like an exercise science or a pre-med, or maybe even a biology. Those are going to be core to that degree. But you could always just, if you were interested in music and PT, you would just talk to your advisor and tell them, hey, I want to get my degree in this, but I know that I want to go on to do PT. So they would set you up and make sure that you're going to take all the classes that you need to. I would say that when you're an undergrad, in order to get into PT school, you need to have good grades. You need to have a high GPA. I would say that the average GPA for someone that's getting into PT school is probably somewhere between 3.7 and 4.0
Oh,
would be pretty standard.
that's high.
Um, it's up there, especially your sciences GPA, they want to be higher. For me, when I applied to PT school, it kind of a sliding standards depending on where you want to go. But most places are going to have a standard GPA, a standard what they call GRE score. So the GRE is like an SAT that you take to get into grad school. It might be phasing out a little bit, but when I was applying for schools, you needed to have that GRE. And
GRE.
so,
Okay.
and they want to have a certain amount of those shadowing hours that we talked about earlier. They want to know that you've seen the field, that you know what you're getting into before you commit to that 3 years of PT school. And if you don't have those 3 things, if you don't meet their GRE, if you don't meet their GPA, if you don't have those shadowing hours, that's what they use as a standard to say, are we even going to look at this person's application or not? So if you don't meet
Okay.
those standards, they're probably going to put you in the next year pile.
Okay.
Um, but when you get to school, it's 3 years long, where in the first year you're doing a lot of learning about anatomy, about orthopedics, which is kind of the science behind joints and muscles and how they interact together. And then you're learning about what's called the pathophysiology of those things. So how they should work, and then what happens when things go wrong. What are the different conditions that you're going to see based off of the stuff that you know and you learn. And then throughout your schooling, you're going to spend some time doing what's called clinical rotations, where you're actually going to go work under a physical therapist for 8 weeks, for 12 weeks in this inpatient setting, in an outpatient setting, inside a nursing facility, so that you can, A, become what they call an entry level practitioner. So you build the skills that so that when you graduate and pass your boards exam, you know what to do, and also to expose you to those different fields so you have a better idea of what you want to do after you graduate, after you pass your boards
Mm-hmm.
exam.
Mm-hmm. Fantastic. Thank you for breaking that down. You mentioned that in your first year, and here I go at students, a follow-up question. He talked about learning anatomy in his first year of PT school. And we have a question from Ms. Burdette and her students about studying and memorizing anatomy. How do you remember all the parts and all the where everything goes and connects, or is it repetition? Is it how do you keep it all in your head?
It's repetition and studying for sure. I remember that as an undergraduate, it used to be a popular thing to do would be to call, cramming or pull an all-nighter, where you would take, a few hours to try to learn everything that you possibly could. There's no way you can do that when you get to graduate school because there's just way too much information. So you have to really be studying all day, every day. And that's just what you do, though. It's part of the lifestyle. You have a group of friends, you go to class, and then after class, you get together and you review everything and you study, and you're spending a lot of time in the cadaver lab. So, in most physical therapy schools, to learn that anatomy, what you're going to do is you're going to dissect a human cadaver from head to toe based on what you're learning. So, everything kind of goes together. So, let's say in your anatomy class, you're learning about the shoulder. So you'll have a list of things where in class you'll learn about the muscles, you learn about the bones and the nerves and the arteries and the veins. And then you're going to go into the cadaver lab and you're going to make a dissection until you can find all those things and identify them. And then in your orthopedics class, you're going to be using, learning special tests and conditions that are all regarding the shoulder. So it's just a lot of constant repetition and use of the same stuff over and over again. And you got to pass the test to keep going through school, so you better learn it.
Thank you for that answer. A couple other questions for you on different topics. What is the policy at the Wellness Institute on you as an employee, like being on your phone? Or like, are you allowed to be on your phone in front of a patient? Do you have to go into another room? What is the cell phone policy for
Pretty
employees?
much just, professional use only. So, you're not going to be texting or taking personal phone calls unless, it's an emergency. If you do, you've got to, go to the bathroom, go outside, make sure that your patient is squared away. But typically they yield to the therapist to kind of use their professional discretion about using the phone. But with techs and other front office coordinators, it's a pretty much out of sight kind of thing. Don't have it out unless it's an emergency or you're on your break.
So it's not okay to just be sitting there on your phone. Like if you're waiting for a patient and they're 5 minutes late, it's not okay for you to just be sitting there in view of other people, just like checking Instagram.
Yeah, I would say frowned upon. It's probably frowned upon to do that. Yeah.
Okay. It's important for students to hear this, that you can't just be on your phone wherever you want,
Yeah,
whenever you
100%.
want. And you're in a professional building. You probably don't own this place. You work for somebody. And so
100%.
they're running a business. And so you are part of that reputation of that
Yeah.
business.
And you would be surprised that, we've had times where there were techs or therapists or people that were on their phone in time where maybe you wouldn't think it's a big deal because nothing's going on. They're on their phone. But patients that are around will say stuff. They'll say stuff to the people that they know that are in charge, and they'll say, "Hey, like, why is everybody on their phone? Or why is nobody doing
Ah,
this or that?" And it just seems to be something that gets under people's skin. And I think as a business owner, that you have a vested interest in not getting under your client's skin or your patient's
yes,
skin because you want them to come back and
that's the
continue to
big
use your
goal.
services. So yeah,
Don't
100%.
don't annoy your customers. So I think that's really, really great for students to hear. Also, how do you use writing? Do you write in your job?
Not a ton. Actually, I do. I do a ton of writing actually. When it comes
Where do you
to,
write?
I do a lot of documentation would be the
Mm.
most amount of writing that I do. So what that means is that every time I see a patient, I'm writing what's called a treatment note. And that treatment note is made up of four different components that we'll call a SOAP note, S-O-A and P. And that stands for subjective, objective, assessment, and plan. So, when a patient comes in and I ask them how they're doing, again, this active listening, I don't, it's not just going in one ear and out the other. I want to know how's your shoulder doing? Did it hurt when you vacuumed again today, or did it hurt when you reached over your head? And that's an important thing for me to write in my subjective information to help kind of determine, are you getting better? Are you getting worse? Or what do we need to focus on? And then the objective portion is everything that we did in that day session. So we stretched for 10 minutes. We did bicep curls with 10 pounds for 3 sets of 10 and XYZ. And then my assessment, I take that information together. Mrs. Jones' shoulder was hurting today when she reached over her head. So therefore, we reduced weight with this exercise and focused on flexibility to allow more overhead reaching. And then in my plan, I'll say, if pain continues to persist, then continue along this track, or if pain is better, then let's continue along this track. And that's something that I do for every single patient, every single time that I see them. But then I also have notes that I've got to send to the doctor who's referring them to come see me. So people will come from the orthopedist, from the neurologist, from the rheumatologist, whatever doctor deems that this patient is appropriate for physical therapy. when they come to see me, I've got to write my assessment and what's called my plan of care, which is basically my justification to see this patient and to have that medical doctor sign off on my plan of care saying I want to see them for 4 weeks, 5 weeks, 6 weeks, whatever it
Mm,
is. And so
mm,
I've got to be able to write in a succinct fashion what's
mm.
going on because these doctors are very busy and they need to see, okay, what's the issue here that you found? What's your plan to fix it? And then me being able to progress them and update them along the way, because sometimes things don't quite go to plan. Or if you go to PT school, what you might find out is that a lot of times there are medical conditions that might show up and look like what we call a musculoskeletal condition. So a person that's complaining of chest pain, you might think that they have a rotator cuff muscle tear or maybe something wrong with their pec muscle. But come to find out that really this is something that's related to their cardiovascular system or a lung issue. Maybe they have a blood clot, something that I'm not going to fix in physical therapy. I need to be able to relay that information to a doctor and have them understand what's going on so that they can get that patient seen in somewhere that's going to effectively treat them. You can't fix a blood clot with bicep curls, but you need a
Right.
different kind of doctor for that.
And so, just one more question about that. You said
Sure.
you have to write succinct notes, but they have to be clearly, you can read them easily, has to be written proper spelling,
Yep.
grammar. You can't
Yep.
just use a lot of slang or shorthand because you need someone else to understand what you're saying. So do you take care with the words you use?
Yeah, really, still to this day, but even as I was first starting becoming a therapist, whenever I would write a note going directly to a doctor, I would always have two or three of my colleagues come and look, say, okay, what do you think? Does it sound professional enough? Would you change this? Would you change
Mm,
that?
mm.
Because again, um, these doctors are what we call referral sources, which means they're sending us our patients, a lot of them. We have patients that do come off the street or come from word of mouth, but we have maybe 10 or 15 referral sources that are
Ah,
sending us patients. And it only takes one bad taste for that doctor to say, yeah, I don't really like the Wellness Institute. I don't really like Dr. Spector because for whatever reason they might have. So it's
well,
important to keep that communication professional
I
and
think that's, speaks to it on so many levels. You're trying to be clear to help the patient with their care and to keep the referral source happy with your services.
100%.
So clear communication matters on all of those levels. And I think and how old are you, Dr. Speck, if you don't mind me asking? You're still a young
I'll be
man.
I'll be 30 on Sunday.
Happy early
I'm 29.
birthday.
Thank
And
you.
so I just think it's so important to students here. He is 30 years old, graduated from his program in 2017 or college in 2017. So undergrad. So you're not saying, oh, I'm young and the new way we do it is we just send doctors emojis of our patients' feelings.
Right.
It
Yeah, I
is
wouldn't
still
go.
just as professional as it was a generation ago or more because all these rules still apply and things have not slid. You have to be professional when you are working inside those walls. I want to start to wrap up, and I want to ask you one final question. And thank you to all the students and teachers for your questions. They were great questions today. What brings you joy about this job? I mean, it's hard work. Every 45 minutes, somebody new. What brings you joy that makes you want to get out of bed and do it every day?
It's really so fulfilling. I was just thinking about this the other day I have a lot of friends with jobs that do, I don't want to harp on any other job, but they have XYZ job where it seems like it's mainly just a paycheck and it doesn't seem like what they do is very fulfilling to them, meaning that it brings them joy. But I every day get the chance to help somebody improve their quality of life. That's a big term in our field, quality of life, which just means how good is their life. And if you can't get up off of the toilet without 8 out of 10 pain, if you can't walk around your house without falling over or, possibly breaking a bone because your balance is bad, um, that's really tough on your quality of life and you can't do the things that you once liked to do. So sometimes I just sit down and think, man, I'm just helping this person get better. I'm exercising with this person. We're lifting weights. If it's the athlete, I'm getting them back on the field. If it's, someone who's coming to see me with chronic headaches, is they've had a headache every day for 3 months, being able to break through and say, hey, I haven't had a headache in 2 weeks or 3 weeks. And I, for the first time, was able to enjoy X, Y, or Z. That's pretty awesome. So You get to make a pretty decent living in this field, and you get to help people.
Love
So
that.
it's kind of clicks all the boxes, you know?
Thank you for that great answer. I want to thank everybody for being here today. Thank you, Laura, for your sign language services, students and teachers. Wonderful questions. As always, you're always here with great questions for our guests. And I think we really got into the job today from all angles. So appreciate everybody's attendance. As I said, after the winter break, we're going to be busy with our contest, our student contest, showing off your employability skills. And we will also have another schedule of webinars for the spring semester. We'll probably get the webinars going to the second half of January. So we will have information through our email to you about all these things, of course, that are free. And you're welcome to, over the break, if you want some reading material, you can check out our website, rubineducation.com. You can see our resources, our products for employability. We are also working on a brand new website, which we hope to launch in January. So lots of good stuff after the break. I hope you all have a wonderful winter break and a happy new year. Dr. Spector, thank you. Happy birthday. Happy new
Thank you.
year. Many thanks again. And we will see you all in 2025.